In my other video, I told you when to go to the hospital or seek emergency care if you have coronavirus. Now today, I want to tell you what happens when you go to the hospital. Hey everyone, welcome to our channel. I'm Dr. Tor. I'm a hospital medicine physician. Since the beginning of the pandemic, I've been dealing with coronavirus patients every day. You may have heard a lot about coronavirus. Nowadays, every TV channel or radio channel, all the magazines, all the websites and social media are filled with coronavirus. Well, we're pretty much tired of it now. Personally, if I see coronavirus on my social media, I'll just swipe and throw my phone at the wall. If you have a family member or you have been in contact with someone who has coronavirus infection and now you're experiencing symptoms, and all of you know what the symptoms are: fever, chills, cough, shortness of breath or difficulty breathing, fatigue, headache, body pain or muscle pain, sore throat, loss of taste or smell, or nausea, vomiting. Now, if you have these symptoms, you may be wondering, oh, do I have coronavirus or not? Whenever you go to the emergency department, you're seen by emergency physicians. They will check on you, they will examine you, they will check your vital signs, including your oxygen levels and temperature. They will run some lab work. Probably they will take an EKG or a chest x-ray. Also, they will test you for coronavirus if you haven't been already tested. Then they will look at all these and they will tell you, sir or ma'am, you have the coronavirus, but you're okay. You don't have severe low oxygen levels, a little bit of fever is okay, all your labs and chest x-ray is okay, so you can go home and take some rest and stay away from people. Good for you. You're not gonna stay in the hospital. You don't like the hospital, I don't like the hospital, no one likes the hospital. Not going into the hospital and not getting admitted is a good news. Now, if you're having more severe symptoms and problems, they will admit you to the regular floor. What's gonna happen in the regular floor? Some hospital physician will come see you, basically, and they will examine you again. And the day after, they will recheck your labs, they will monitor your blood oxygen level, they will check the inflammatory markers, which indicates how severe your coronavirus infection is, and then they will tell you if you're improving and you can be discharged soon, or you're not improving and you're going in the wrong direction and they'll probably need to keep you more. Now, depending on the severity of your disease, your hospital physician might consult other specialists like lung doctors or pulmonologists or infectious disease doctors. Now, those doctors will help in your treatment. Based on your signs and symptoms and your numbers and your oxygen level, you may be eligible to get the treatments. There are some treatments going around. Of course, there's no definitive treatment for coronavirus. Everyone knows that. But there are some medications that have been proposed that they may be helpful in treating coronavirus patients, like remdesivir that FDA just approved for treating coronavirus patients, which is an IV medication. They gave 5 to 10 doses, or they may give you tocilizumab. Tocilizumab is an anti-inflammatory type of medicine that will affect on one of your cytokines, which is an inflammatory marker, and it has been shown that it will help treating coronavirus patients. Or they may enroll you into a clinical trial for receiving other treatments. Like, for example, in our hospital, we're conducting a clinical trial on convalescent plasma injection in coronavirus patients. Doctors will also treat your other medical conditions, especially if they're exacerbated by coronavirus. For example, respiratory disease like asthma and COPD might be exacerbated by coronavirus infection. Coronavirus is also thought to be causing blood clots more than usual. So they will start you on blood thinners to prevent blood clots, or if you have any clots formed, they will give you even higher doses of blood thinners. And then they will monitor you and they will see how you progress or improve, and then hopefully they will discharge you soon. Now again, if at any point you're going into the wrong direction, which means that your oxygen levels are going down or your numbers are going up and up, or you were so sick to begin with, you will be admitted to the intensive care unit. What happens differently in ICU? If you have a bad pneumonia or your oxygen levels are very low, they will put a tube down your throat and hook you to a breathing machine or ventilator so the machine can help you with the breathing. Of course, they will put you in an induced coma so you won't know any of these things. And then they will keep you on the machine, monitor you every day, and I would say every hour, and hopefully your pneumonia will resolve and your oxygen levels will improve, and they can then transfer you to regular floor from where you can be discharged home later on. Believe it or not, but sometimes they will even turn you upside down. Turning patients upside down or proning is proven to be beneficial in cases of ARDS or acute respiratory distress syndrome, which are caused by coronavirus or other infections. Now, oftentimes we see the patients with low oxygen levels, like in 60s and 70s. When we turn them upside down, if there's no technical problems, of course, the oxygen levels will come up nicely. So if you wake up in the hospital bed and you see the floor instead of the ceiling, don't panic. They're proning you for a reason, and it's a good reason. So in all of these scenarios, your body and your lungs need to take care of the coronavirus. No matter how severe the infection is, no matter which medication are we giving to you, it is your body which needs to fight the coronavirus. Of course, if the patients are older or have a lot of other medical conditions, the body has less strength to fight the virus. And I don't mean they can't fight the virus. There's a lot of old people with a lot of medical conditions who fought the virus successfully and improved, but it's harder for their body. And basically, if the oxygen level does not improve with all these measures and the mechanical ventilation, then, the coffin dance. Now, when your symptoms and condition is improving in the hospital, your doctor may discharge you. Some patients ask me, am I treated completely that you're discharging me? No, discharging you from hospital means that you can handle the rest at home, which means that you have to go home, stay away from the other people, practice social distancing, isolate yourself, and monitor your signs and symptoms so the disease course will finish and you will totally improve. Now, this was a quick rundown of what happens in the hospital when a coronavirus patient gets admitted. I hope you all stay safe and you never go to the hospital for any reason. If you have any questions, hit me below in the comment section. Don't forget to share this video with the people you love and subscribe to our channel for more and more videos to come. Take care.